Dear audience, welcome to my 6-month progress report. Let me introduce my PhD topic, which is control of fear memories and management of dental anxiety. I'm Ábel, a 5th-year dental student and a 1st-year DMD PhD student. And my vision is less anxious patients in the dental office. And my mission to achieve this is to provide data for policymakers to create guidelines. I have 2 specific projects for this year. Let me talk about my first project, which is about dental fear and anxiety and its possible management methods. Please look at these pictures. How do you feel about them? For most of us, these are everyday work instruments, but for some of our patients, these can be the subject of their fear. This diagram clearly shows that the reason fear from dentists mainly arises from pain and injection. If this fear becomes so severe, we can call it a condition, which is dental fear and anxiety. This is unrealistic negative emotions associated with the dental treatment. It's affecting 150 million people in Europe and US together. If you think about going to the dentist, everyone can have some kind of fear. But for patients with dental fear and anxiety, this fear can be so severe we cannot provide them the treatment that they need. Some of them can't even open their mouths in the dental chair, which can lead to untreated dental conditions, which also affect their systemic health. So we have to do something about this. There are different interventions, like psychotherapies or behavioral therapies and pharmacological interventions. Let's focus on these. We have benzodiazepines, which are effective and potent drugs, but they also have notable side effects and addiction potential as well. We also have herbal extracts. The 2 most common are valeriana and passiflora, which can be effective as well. So our aim in this project to find the most effective yet safest management methods for dental fear and anxiety, which is our clinical question. We would like to investigate patients undergoing dental treatment with pharmacological interventions like benzodiazepines, herbal preparations, their combinations, different administration routes. We would like to compare these to placebo, and our outcomes are mainly anxiety scores or physiological parameters indicating anxiety like blood pressure or heart rate. We also would like to investigate the safety profile, the side effects listed in this slide. So our hypothesis here is that benzodiazepines and herbal preparations can effectively reduce dental fear and anxiety, and the latter have better safety profile. So the clinical implication for this project, that if we can effectively reduce dental fear and anxiety, we can provide the patients the treatment that they need. Also, we can have with the patients better cooperation, the patients will have better satisfaction, and as we know from practice, a calm, relaxed patient will have less complications after our treatment. So we did the preliminary research and found the previous systematic review and meta-analysis, but there's also room for improvement. We can include new articles and focus on herbal preparations, which is missing from this previous study, and also investigate the safety profile. Here you can see my 3 key articles regarding the herbal preparations. So we designed a 2-domain search key. The first one is targeting dental fear and anxiety, and the other one is about the pharmacological interventions. So now, after the duplicate removal, we had above 13,000 records, and after the title abstract selection is still above 700. So now we are in the full text selection phase with the deadline of end of this month. So let me introduce my second project, which is about a special population with congenital heart defects and their oral health. So what are congenital heart defects? It's when a baby is born with abnormally structured heart or larger vessels. It is the most common type of birth defects worldwide, affecting 40,000 births per year only in the US. In other words, we can say in every 15 minutes a baby is born with a heart defect. So likely by the end of my presentation, somewhere in the world, a baby is born with this defect. As dentists, we are interested in teeth. So we know that congenital heart defect patient has weakened and altered tooth structure, making them more prone to caries. Also in this patient, the rate of enamel defects are higher. So as I said, the congenital heart defects somehow affect tooth structure, making them more prone to caries. If it combines with poor dental hygiene, these can lead to severe infections in the mouth. But it's not only affecting their mouth, these infections can affect their other vital organs, such as the heart. And the heart of these patients are not so resistant because the condition and these patients are more susceptible for severe heart infections like infective endocarditis. Its incidence can be 100 times higher in these patients. This condition is caused by bacteremia, which can be induced by the patients themselves, by brushing their teeth or just chewing. And as dentists, we can cause bacteremia by different dental procedures. So if we work in an environment full of caries, infection, or periodontitis, the risk of getting the risk for a patient to get infective endocarditis after our treatment is higher because these are risk factors for this condition. Unfortunately, infective endocarditis is a life-threatening condition and really difficult and expensive to treat. So we have to prevent it. The first step in this prevention is to establish a connection between congenital heart defects and the oral health of these patients. So that's the aim of our study. So the clinical question is there a difference in oral health parameters in patients with congenital heart defect compared to healthy individuals? We would like to investigate patients with or without congenital heart defects, and our outcomes are caries prevalence, different indexes, periodontal status, gingival index, and bleeding on probing. Our hypothesis is that patients with congenital heart defects have worse oral health parameters. So the clinical implication is that we have to be really aware when diagnosing congenital heart defects, and clinicians should refer them to the dentist for tight dental control. As dentists, we have to be really careful and focus on prevention instead of treating the conditions because of the risk of endocarditis. So we designed a search key, a preliminary search key with two domains. The first one is about congenital heart defects, and the other one is about oral health parameters. The preliminary search showed that there's a previous systematic review, but not a meta-analysis. So we can now conduct a meta-analysis, include new articles, and investigate other oral parameters than caries prevalence. So let me summarize my two projects. The first one is about dental fear and anxiety and its possible pharmacological management methods, and the other one is about a special population with congenital heart defects and their oral health status. So I would like to end my presentations with the word of Ábel Szentgyörgyi. A discovery is said to be an accident meeting a prepared mind. So thank you for your attention.
Thank you for your presentation. You mentioned that benzodiazepines are the most commonly used medications, and you also mentioned that it has some side effects. What are those side effects?
So the most important, I think, is anterograde amnesia. So if we give the patient the benzodiazepines, they most likely not to remember the procedure, and for ethical reasons, maybe it's questionable if we do a procedure for a patient with in a sedated, like when they are sedated. And the other side effects can be the addiction potential, and when someone has to have a long treatment, of course we can't give them always benzodiazepines, so that's why we brought in the herbal preparations, because they are not that strong, but can be effective as well. So there's another option for the fear reduction.
Thank you so much.
Thank you.
Thank you. There are also questions there, and then the committee. Thank you. Please. Yes.
Thank you. Thank you for your presentation. I wanted just to add that for the kids before anesthesia, we are regularly using benzodiazepines and without any major side effects. So it can be used for oral procedures as well. And my question would be, I did not get how the connection is between oral health and congenital heart diseases. Maybe the congenital heart diseases are not a sole abnormality in those patients, or is it together with some other diseases? Or I just wanted to ask this. Thank you.
Thank you. So that project comes from clinical evidence, because we talked with cardiologists and they said somehow the kids have very bad teeth. And now we would like to investigate if there's a connection between them. And also for their condition, they are getting drugs, which may be affecting their saliva production or other parameters which can cause caries or some oral manifestations.
Thank you.
Thank you.
I have a question, Ábel. Congratulations to your presentation. My question is to your first topic. Is there any guideline to use herbal products in case of children to reduce anxiety and mental fear?
As far as I know, there isn't, but yeah. Based on the articles I've found, I don't know any studies about children and herbal preparation. So mainly they are using benzodiazepines or similar drugs. But maybe that would be helpful to conduct one later.